Philo, and everybody calls me Jay. The kids that I work with call me Miss J, and everybody else I know calls me Jay, so feel free to do that today. With any questions, shoot them towards Julie anytime that you would like, and I'm happy to answer them. So what I want to do during this webinar, I want to show you how I implemented myofunctional therapy and started my own practice, and I now make over $60,000 a year just working 2 days a week. And I know that's awesome for me, but I want to show you how you can do the same without breaking the bank. So that's our goal of today. So welcome to the webinar. Really, I've just been waiting for today so that I can share with you how Simon Says is changing things in 2019. And I know that if you're watching this webinar, you're either interested in myofunctional therapy, possibly you've been practicing it for many years, you're the myofunctional expert in your practice, in your area, in your school, or there might be some of you joining us today who have no idea what myofunctional therapy is, but you want to know what all the hype and all the talk is about. But for whatever reason you're here, I'm excited you're joining us. We've all got busy schedules, right? We've got clients, we've got family to attend to, and we have errands to run, but please stay with me until the end, because if you stay until the end, I'm going to give you a little treat. I want to share with you a video of a thumbs up session. So an initial session that I did with a little one at one of my seminars, and it's super fun to watch. And I think it'll give you a great glimpse and view into what Simon Says and what our programs really are. Are we all good? Okay, great. So, oh, I need to be moving that. That's great. All right, so anyway, just to tell you a little bit about myself. Great. I just wanted to tell you a little bit about myself. So I'm a speech language pathologist. I graduated from the University of Wisconsin, go Badgers, in 1995 with a BS in communication disorders and a dual major in education. Then I came home to the Maryland area and I went to GW University to get my master's, which I loved. Their program was amazing and I'm still grateful for my experience there. I probably have worked in when I graduated, I went into neurological disorders and I worked probably in every acute care, outpatient, inpatient, rehabilitation setting in the Maryland, DC area. And I did that for a many number of years. I started Simon Says as a private practice for clinical work when I started having children, and I worked primarily with stroke and brain injury clients. I created a program called Reading for Life, which were aphasia book clubs, and I presented at ASHA about that really positive life participation approach, and that was a focus of my career for many, many years. Then I happened to fall into a myofunctional therapy class, I attended, and fell in love instantly. And I knew that it was the next avenue that I was going to go into within my practice. And at the time I was sitting in a room full of people and there were only 3 speech pathologists, and the biggest epiphany I had was, A, why are we not taught this in graduate school? And B, why are there not more speech pathologists here? Because this is really the perfect scope of practice for us. So I've continued my education in the world of myofunctional therapy. I've attended an IAOM conference in 2010 and AOMT1 in 2016. I've gone to advanced Buteyko breathing courses in 2016, and then went to a mastery course just in 2018. I'm constantly wanting to know more, learn more, and do more in the world of myofunctional therapy. It is my obsession, my love, and this niche is something that I think you guys will appreciate as well. For the past year plus, I've been teaching seminars to speech language pathologists around the country because I am super disappointed that our graduate programs don't arm you all with the knowledge that you need to be treating these patients, and yet it's just so necessary. So that's enough about me. I want to tell you a little bit about what myofunctional therapy has done for me professionally and personally. So, like I said, I've spent the last year traveling around teaching seminars around the country to amazing speech pathologists. There is nothing more rewarding than sitting in a room of collaborative, powerful, smart, driven, therapeutic-minded clinicians who just want to better people's lives. And I love sharing stories, and I love hearing their experiences and talking about what myofunctional therapy can do for their practice. And it's been fun to then see the trajectory of their progress and their successes in business. I mean, we've had Emily who came to our seminar a year ago, and she works in the schools full time, but now she does myofunctional therapy on the side and helps me with my 60-person waitlist caseload at one orthodontist's office. So the stories just go on and on. Myofunctional therapy has also been a way for me to achieve a work-life balance that I really didn't have before. So working in the hospitals for many years, you guys know it. You work full-time, you work weekends, you work holidays, and you make fine money, but maybe not enough to pay off your student loans or to support your family. So myofunctional therapy has allowed me to achieve goals that I never really thought were attainable. There's a picture of my little cuties. I have 4 daughters, and which means that they are amazing. They keep me busy and they keep me pretty emotionally unstable most of the time. But thank God I have my wonderful husband to help me manage all those emotions and also to help me with business. So love doing this with you. Also, myofunctional therapy has enabled me to give back, and that's something I think all of us can relate to. We're speech pathologists for a reason because we care about people and we want to make a difference in their lives. And luckily, we have a wonderful, excuse me, nanny or babysitter that's been with us for many years. And Umi is from Indonesia, and she started an orphanage years ago, and we have been able to support her in those efforts through the success that I've had with my myofunctional therapy business. And we send them supplies regularly and do fundraisers to help them. So again, I've achieved a lot of success doing myofunctional therapy. I've even shared with you guys my earnings, and I've showed you over 2 years. In 2016, I was making over $66,000 a year. And in 2017, I started traveling around doing the seminars. So it went down to over $58,000. But let's be clear, this is only working 2 days a week. So I can't even imagine what would be if I worked full time in myofunctional therapy. I do want to make an earnings disclaimer, like you're being here today, learning about this, you're not going to make this money immediately, but hopefully the potential is there for your future success based on what we've created to share with you today. So one thing, and really the biggest thing I want you to get out of today's webinar, is the idea that OMT should be for all SLPs, okay? We've traveled around the country. We have met you all at ASHA. We have taught you at our seminars. We have communicated with amazing SLPs via social media, via emails, and we learned one main thing, is that OMT should be for all SLPs. It is a crying shame that it is not taught in our graduate level courses, though I assume and I anticipate and I expect that maybe it will be in the future. But until then, we at Simon Says want to make it accessible, we want to make it affordable, and we want to make it all inclusive. I want to tell you a little story about my buddy here. He is one of our great success cases. So this little guy was in 4th grade. He had been in speech therapy for over 2 years to remediate frontal lisp, really with no change. And when he came to see me, the complaints, the list just kind of went on and on. It was open mouth chewing, tongue thrust swallow, anterior lisp, open mouth breathing. There was even some asymmetry in his facial muscle function. And after our tongue tips program, we did some preliminary work. He then got in some expansion. We worked together with the orthodontist, then jumped right into tongue tips. And now this guy is a nasal breather, perfect speech, perfect swallow. He's able to sit at the table with his family. This was a big complaint, to have dinner together with his family without spitting all over the place. I mean, he was getting made fun of at school, and parents were upset at their dinner time meals. And now all of those things have been resolved, all of those issues. So this success story is just one of a gazillion. And I know that you can have them with your clients too. And you know that this guy looks like so many kids that walk into your door. So what I want to do now is I really want to tell you the top 3 reasons why you need to start implementing OMT into your caseload immediately. Reason number 1 is because most of your caseload is affected by an orofacial myofunctional disorder, and you might be overlooking it, or you might recognize it, but you just don't know how to treat it. Okay, so let's get to what might some of these symptoms be. In your caseload, do you see patients that have oral habits, thumb sucking, finger sucking, nail biting? Do you see patients that have a tongue thrust or what they might call an immature swallow or a deviant swallow or a reverse swallow? Do you see open mouth breathing? Do you see open mouth chewing? Do you see structural abnormalities? Do you see frenums, tethered oral tissues, either of the lip or of the tongue? You might see enlarged tonsils. There might be enlarged adenoids that then thus cause somebody to be a mouth breather. Do you ever see lingual scalloping? Those are those marks that go around the perimeter of the tongue because the tongue is resting in the wrong place. Do you see grinding or clenching or TMJ issues or complaints? We see that a lot with some of our older patients and even some younger patients. And of course, because we're speech language pathologists, we see those patients with those speech sound errors that we just can't resolve. So the important question is, you see these symptoms, but what are the consequences? The consequences of these untreated myofunctional disorders are things that sometimes we recognize and sometimes we don't. Number one at the list is orthodontic relapse. These are the kids that go from orthodontist to orthodontist to orthodontist, always either feeling like they didn't wear their retainer and that's why they relapsed, or maybe they had the braces come off and the orthodontist never mentioned to them anything about their tongue. Nobody ever mentioned anything about improper resting or swallowing. These patients end up having periodontal disease. I see it all the time. Of course, malocclusion is one thing that you see initially, jaw joint problems, biting, chewing, swallowing abnormalities. Some kids we see with excessive grinding or bruxing of the teeth. Why do they do that? Because they can't breathe at night. They are doing this in an effort to open up their airway because they do not have an adequate airway for breathing. And these are your kids that you might have sleep disordered breathing or sleep apnea. Lifelong misarticulations, a lisp, neutral R, interdental alveolars, the list is kind of endless. But we know that if you're not using your muscle function properly at rest or in function, it leaves a mark. So improper use of these facial muscles can actually cause changes to the way that you grow and develop in the structure of your face and actually your whole body. So the list really goes on and on. All right, I always like to put this picture in here. I put it in my seminars and I put it in my webinars. I think that we can all name so many of these, but we see our little thumb sucker. It's so cute when they're little, and then it's terrible when they're older. And once they get a hold of that thumb, it's pretty tough to let go of. But I promise you, the Thumbs Up program is empowering and it is amazing, and the kids love it, and I love it. It's like one of my most favorite parts of the whole program, programs that we offer. Of course, you can see the tethered oral tissue down below, that tongue tie. You can see an anterior tongue thrust that's either during speech or during swallowing or even at rest. You see that low tone, open mouth, breathing, resting posture off to the right. These are so many of our kids. We see a little one down in the bottom with lingual scalloping. Again, I already told you that comes from the tongue resting in the improper position, literally between your teeth. Like rest, I see this all the time. And once they realize that why it looks that way, you can help them change it once they build up the muscle strength. And of course, our little Shih Tzu there, because they always have tongue thrusts, and I love to show it. So reason number 2, guys, the second reason that I want to share with you today is that myofunctional therapy is already in your scope of practice. No other practitioner can treat speech, swallowing, orofacial muscle function, and breathing. Okay, guys, go to ASHA's website, check it out. You will see that we are listed, or OMT is listed as an area that we can and should be working on with our patients. Why are we not taught this in graduate school if we are expected to implement it in our practice? So Simon Says is here to help you guys with that. But other practitioners practice myofunctional therapy and they're amazing at it. But we are the only practitioners that can treat speech, swallowing, orofacial muscle function, and breathing. I like to share a couple articles because there are hundreds of research articles, and I'm grateful to some amazing practitioners out there like the Linda D'Onofrios of the world who have compiled myofunctional articles, or articles that support myofunctional therapy in relation to other issues. And so there are a couple articles I'd like to share. This one was in the Journal of Speech and Hearing Research, and it showed that 38% of the various populations could have an OMD. I mean, guys, if you think about it, 4 out of 10 kids that sit in front of you might actually have an OMD. It feels right to me. If you look around a room full of people, that number seems spot on. And the research also has shown that, and this is going to blow you away, 81% of children with speech articulation issues actually likely have an OMD. So if 81% of the kids that we're treating actually have an OMD and we don't have training in myofunctional therapy or don't know how to implement it, then we're doing these children a disservice. So we need to help them have success. So what does myofunctional therapy include? Easy enough, right, guys? Myofunctional therapy includes eliminating oral habits, teaching people how to breathe nasally. So it's breathing re-education. We are born nasal breathers. Why do we become a mouth breather? Something makes us start breathing through our mouth. And it's important for us as myofunctional therapists to investigate the why and make sure we're working and collaborating with the best professionals to work together as a team. Okay, myofunctional therapy includes establishing correct oral and facial rest postures. Okay, your resting posture location is as Sharma Sharp says, your operating zone. So if we are not sitting in the right place, then we're not functioning in the right place, and that will have a detrimental effect on the way that we look and the way that we grow. We need to instruct our clients on how to chew and swallow correctly. All right, so there was a talk at ASHA a couple years ago that made a correlation between a previous existence of a tongue thrust, which essentially is an oral phase dysphagia, and later issues with a neurological impairment that could affect pharyngeal capabilities. So if you don't have an adequate oral phase of the swallow, and later in life you then have a pharyngeal component to your dysphagia, you're already starting behind the 8 ball. So we need to ensure that children and adults have a proper oral phase of their swallow to make sure to add to the protection that later could come when they have issues later in life. We also need to habituate these good habits. So it's not enough to just sit there and give them a few exercises. There are tons of programs out there that you can just pull off the shelf where it just teaches you some exercises, right? But that's not the key. The key is that you have to then take those exercises, take the function, and make it be in everyday life. I can't tell you how many sessions I do down at Starbucks. I mean, maybe it's because I want a nice tea, but it's also because I want these children to get out of the therapy room. I don't want them to be therapized. I want them to sit in everyday life. Our last session, we go out for lunch together. I have them bring friends. We meet at the mall. I mean, we are doing these sessions in their everyday life so that they can habituate their good habits. I mean, I even have a couple kids right now that are like obsessed with Fortnite. I mean, because who isn't? That's a young boy or girl of the age of 10 to 14. And I have them tape their lips to establish nasal breathing while they're playing. It doesn't really help for their communication. I'll let them take it off for some of the time, but we try to use the everyday things that they do and implement myofunctional therapy into their everyday life. And of course, most important to us is myofunctional therapy includes correcting speech sound errors. Nobody can tell me that you can do myofunctional therapy and not address those speech sound errors head on. Yes, you need to improve muscle function, but you must drill it. That's what we were trained to do. So those are the goals of myofunctional therapy. Favorite article, guys, favorite article. I take it into every orthodontist when I go in to speak with them because they've all seen it. They might not remember it, but they've all seen it. In 2010, Smith, Peter et al. Did a study looking at, and it's kind of cruel. I mean, I feel kind of bad for the people that were in the control group. But they took a group of individuals just in a control group and they just gave them orthodontics. And they knew that they had a previous diagnosed tongue thrust, is what they called it in this article, versus those that were put in an experimental group that received both orthodontics and myofunctional therapy. Guys, look at the relapse here. This is number 1 on the consequence of not treating an OMD. Those who received myofunctional therapy and orthodontic appliances had 0.5 millimeters of relapse. And I think that if you probably took the general population and looked at relapse, 0.5 might be relatively close to that. Because our perfect bites don't always hold after we get our orthodontic appliances off, although we want them to. But 3.4 millimeters of relapse in those that only got orthodontics. So guys, the proof is in the pudding. I mean, this is really it. And when I show these to the orthodontists that I work with, they're saying, yeah, I've been in a battle with the tongue and all I want to do is have success with my clients. So you're their insurance policy. They love having you be a part of their practice. So I'm going to wait 1 second. I want to tell you that now we've looked a little bit, I mean, really quickly at myofunctional disorders and the goal of OMT. And I want you to look back and rewatch anything that you need to, or even look at any of my previous webinars that go into much, much more detail about myofunctional disorders, because I know I zipped through it. And I know the biggest thing is that you might be sitting there just thinking about your patients differently. That's what I always say at my seminars, that you'll look at your patients differently than you did before. That patient that's been in speech therapy for so many years with minimal improvement is like seared in your mind, it's seared into your brain. And we at Simon Says are so happy that we're making OMT for all SLPs. It's affordable, it's going to be accessible, and it's going to be inclusive because it solves these underlying issues of decreasing our caseload, helping our clients improve and graduate. So reason number 3 that I want to share with you today is that I've done a lot of things right and I've done a lot of things wrong. And what I've discovered the hard way is that there's actually an easier way, and you guys get to benefit from the idea that my 9-year learning curve is going to become your superpower, armed with everything you need to be successful. I want to give you the tools, I want to give you the materials, I want to give you the business acumen and the support that you need to be successful. And that's the fun part. So whether you're starting your own practice or getting those tough to treat kids off your caseload, or just adding it to your arsenal of therapy tools, Simon Says is so excited about the new launch, because what does it mean? We want you to get certified in our programs. Okay, so I want to take a little bit of time to tell you about what those programs are. We have 3 myofunctional therapy programs. So we've just recently added our 3rd one and are pumped about it. I'm sure you've heard me talking about it. The first one is Thumbs Up. It says thumb sucking elimination program, but it's really an oral habit elimination program. We work with finger sucking, nail biting, tongue sucking, tongue pumping, lip biting, et cetera, et cetera, et cetera. Any of those oral habits that can have a negative consequence on the way we grow and develop. Tiny Tongue Tips is our little baby of a program, and it's an early intervention myofunctional program that I will tell you a little bit more about, and I'm so excited about. And so grateful to Emily, one of our Inner Circle members, for being a very integral part of helping develop that. I always joke, and I'll be blunt and honest about it, that growing and starting my profession working with adults in the neurologic kind of industry, working with strokes and brain injuries, et cetera, I didn't have as much of the pediatric experience. And so I love learning from all the speech therapists that come to all my seminars, because you might have, I am a swallowing expert, but I might not be that pediatric infant feeding specialist. And we've had Alex and Mandy and some other amazing speech therapists who have educated me along the way. And Emily is just another example of that. She works in a preschool full time, and really made us realize, as did Jen and Jillian, and Kim, that we were missing just like a little window of time that these kids could be getting some therapeutic intervention early. So thanks to all of those team members for helping us. Tongue Tips is our quintessential, basic, ground-up orofacial myofunctional therapy program. So those are the 3 programs. I told you a little bit about each one, but Thumbs Up is based on a behavioral modification approach. It's 30 days. It's positive reinforcement, it's empowering, and you can see these pictures. I mean, the child up on the left-hand corner sucked her thumb, oh my gosh, 24 hours a day. She was in 4th grade. She had 3 habit cribs. And if you don't know what a habit crib is, it is a terrible piece of metal that hangs halfway down in the middle of your mouth. You can't even talk. She had 3 of them. She broke all of them. Mom was at her wit's end, came to me, and worked in a day. Thumbs Up, worked in a day. I mean, that was the best party I went to. They had family and friends over. Mom was over the moon excited. Little one had her whole Girl Scout troop over. And so I played pie in the face with them, and Mom and her friends had a glass of wine and a veggie tray. So, these celebrations are exciting, and they're happy to have you be a part of it, and you feel a part of their family. So the key is that Thumbs Up is really your fundamental step. You have to do it first before you do anything else. But then you can jump after a period of time. If your tongue does not improve and your resting postures don't improve, then you can jump into Tongue Tips. I say it's 12 sessions on average, but it really varies so much. If there's a speech component, like a speech sound error component, oftentimes I will, as I'm spreading out sessions to habituate them, I'll just integrate that speech and breathing into those in-between sessions. It's a neurologic, re-education of the muscles. So they're therapeutic exercises for your lips, for your tongue, for your facial muscles. You teach a new swallow, you teach proper breathing, you teach proper chewing. You know, I think that somewhere along the line in our industry, somebody somewhere seemed to indicate that oral motor is bad. Oral muscle exercises are bad. And I greatly disagree. I think they are fundamental, and we can't expect to improve any speech sound production, any function, unless you build up the musculature to support those changes. So anything I'm working on, you have to get the fundamentals. You've got to get the ground strong to be able to build up from there. So that's tongue tips. And then, as I mentioned, Tiny Tongue Tips is this early intervention program. So we know that form follows function, right, guys? We know that if we get in there early, that we can make some changes, right? We know how important early intervention is in our field. So myofunctional therapy is no different. And Tiny Tongue Tips is the first program of its kind to really work on those early skills. It's play-based. It teaches these younger children, ages 3 to 6, proper postures, okay? And we've made a very regimented program. We don't expect perfection. We don't expect perfect speech production. We really just want to expose them to proper speech production so that when they get to an age where they're expected to do it, they have that muscle function, control, and support in order to achieve it. Similarly, we see so many of these myofunctional kids are eating predominantly soft diets because they've gone from their baby food to their squeezable Go-Gurts to their squeezable applesauce, and that's how they live to their mac and cheese, to their chicken nuggets. And this is how they live their days. And this program actually is a way to encourage them to expand their repertoire of foods in a very regimented way. So that's been super fun to watch. Okay, so here we go, guys. I think we're going to try to access if there's questions. Is that what we need to do? Okay. What I want to say is that in the past, OMT certification can cost a lot of money, right? It can cost upwards from $2,000 to $5,000. I know what I spent when I went to my myofunctional courses over the years. And I kind of feel like my graduate school education, well, you can see I went to GW, cost over $60K. What did yours cost? I graduated a long time ago. And so I know prices have gone up. But, you know, we've really paid our dues. Our student loans are outrageous, and it's all in an effort to help people. I sometimes think this is like counterintuitive. Like, here we are in a field where all we want to do is help people improve and get better and make changes in their speech and their swallowing, etc. But yet it costs us so much money to get trained in things that we need training in. So what we did is that for the past year, while we've been training our seminars, we've been having conversations with speech pathologists. We're talking to you at the seminars. We're talking to you at ASHA. We're talking to you via social media and via emails. And I love that you guys communicate so much with us. But we decided in 2019, we were going to make a drastic change. We wanted to make OMT available for all SLPs, and we wanted it to be affordable, and we wanted it to be accessible, and we wanted it to be all inclusive. So I want to ask you a question. I have been talking a mile a minute. I've been like zipping through this webinar. I really breezed really quickly through the myofunctional stuff and through the OMD identification stuff and the cases that you see in your caseload. But I want to ask you, are you feeling overwhelmed? And my brain sometimes goes a little faster than I can keep up with. So I want to share with you what we've been working on for the last few months in an effort to get to today's launch. I'm hoping, can I share that with you, the changes that we want to make? And I hope so. I'm going to pose that question to you guys. You know, can I share with you some ideas about how to make these changes? Okay, what have we done? Here it is, guys. This is what moment we've been waiting for. We have created the Simon Says membership. We have created a membership portal, a community of the most forward-thinking and powerful group of inspired SLPs on the planet. I always crack up when I look at the language of that. It's like so dramatic, but it should be if I have 4 daughters. But I want you guys to think about that. I really want to create a community of speech-language pathologists that can all collaborate and talk and get the support that they need to make OMT a success, professionally and personally. And I want to spend some time now sharing the new launch with you and showing you what this membership is really all about. Because you know that we've already talked about the seminars that are out there, how expensive they are, travel is tough, and I know because we've asked people to come to ours, and we've loved the experiences we've had with everyone. But let me tell you a little bit about what you're going to get if you join our membership portal. If you join our Simon Says membership, you're going to get certified in all the Simon Says programs. Now, I've already talked numbers with you guys, right? Like they're there in red for you to look at because you know what the numbers are. But this means that you can attend any or all of our seminars. We have them 4 times a year. We travel around the country, and you can come back as many times as you want because we're always adding content and we're always trying to add something different to each seminar. So we might have a personal trainer come in to talk about leadership training and how to have effective communication when you're doing a webinar with a professional and help walk you through the process of that. We might have Stefan lead some talks about setting goals for yourself and how to make sure that you're meeting those goals. But the nice thing is that some people come as they we've been doing this for the past year. We basically say, come to a seminar, you can come to all, you can come to one, you can come to as many as you want. And people always come back. And why are they coming back? Well, some of them are coming back to follow up on the business goals that they want to chat with either Julie or Stefan or some of our other team members because they need a little help with that business acumen, which is amazing. Some of them just come to give updates on how much success they've had using these Simon Says programs in their practice. And some of them just want to come and add value to our class with their experience. And I love that. Some of them just want to come in and give us a hug, tell us what the successes that they're having. And that's pretty fun for us to watch as well. So whether you're coming to one class or you're coming to all classes, you get certified in all of our programs and you can join us. Okay, so what does that mean to get certified in all of our programs? As I mentioned earlier, Tongue Tips is one of our programs. You can see that I have lesson plans and the way that they're very organized. They've been mapped out with icons to tell you what muscle group and what function you're working on. Because remember, form follows function. So you have to know what you're working on. I mentioned before that idea of somewhere along the line, speech therapists thought oral motor is bad. And I say oral motor with intention is amazing. And that's where you get a change. So there you can see our lesson plans. We have videos for all of our exercises. We've created cards that you can use to share with your clients. I have Mandy, this was the cutest thing that she did. She has a mailbox in her office, and when kids come in to do therapy, they go over to their mailbox, they open it up, and for her myofunctional kids, she puts the exercises in the mailbox, in her cards, she brings them out and they lay them on the table, and they know that those are the exercises that they are teaching for that lesson. I think that's like beyond adorable. We have a placemat that we use to teach proper eating, proper chewing, and just reminders. And then I laminate that and I send it home with them, and they can use it at home. Our evaluation tools, I mean, this is literally like 1/10 of what's in there, but that's the Tongue Tips program. You can get certified in our Thumbs Up program. We have created so much content that my husband was like, stop coming up with ideas. Please stop coming up with ideas. But I can't help it because you know us speechies, right? Like we get creative and we get excited about ways to teach children proper form and function. So I We created a video Powtoon that explains to children what the consequence and what the detriment is of thumb sucking. Why do they think thumb sucking is bad? Because they think it's germs. They think it makes their teeth crooked. And there are 10 other reasons why they need to stop their oral habits. And this video introduces them to their superhero, Thumbs Up, who explains why they need to stop their oral habit. We have scripts that tell you line by line what you can say, although you might choose to make your program your own. We have a materials list that tells you what things you might need in order to implement this program in your practice. Lastly, we have our Tiny Tongue Tips program. This is my little baby. Actually, this is literally my baby. This is my daughter, Devin. She's doing one of the pictures. We've created cards, just like we did in the Tongue Tips program without pictures. We've created Tiny Tongue Tips with pictures of children doing these oral facial exercises so that the child can see it and imitate it. And also be having your auditory explanation of what they need to do. The Tiny Tongue Tips program has an explanation of what things they're going to work on. And then my favorite thing that we created is these lesson pads. So off to the right, you can see that we work on warm-ups, we work on mouth time, we work on breathing time, we work on speech time, and we work on sip and swallow time, sip and snack time, I'm sorry. And those are pads, they're 9 by 11 pads. And so if you have 4 people in your group, in your Tiny Tongue Tips group, you just pull one off for each child. And we have over 250 pages of activities, 250 pages of the program, many of those activities to do to address each of these issues. So that is Tiny Tongue Tips. So what are you going to get? We've talked about getting certified in all the Simon Says programs, but you're also going to get business development support. Now, guys, this is really where I want to talk about the fact that Simon Says is different from so many other myofunctional therapy programs or so many other myofunctional training programs out there, is that we want to, and we are excited about, and we are proud of the business support that we share. It's really what differentiates us from everybody else. Okay, so let me even show you a little video. This is one of our classes we had in LA, and I usually bring an orthodontist or a dentist with me to educate. But this is a video of Deanna, one of our Inner Circle members, and her talking about her experience.
I'm a speech therapist based in Frederick, Maryland. And I'm a member of the Simon Says Inner Circle. And my favorite thing is the knowledge and community support that they give me to help me build my private practice.
So guys, you can see I brought Dr. Sheehan and I brought Brian Barry. He was from Dale Carnegie to do some leadership training.
All the new stuff that comes out, and share it with us. And I just love knowing that we have a machine in there.
Okay, so you can see that was Deanna. Awesome job, Deanna, telling us about her experience, but it's really the truth. Like, we really want to be there for you, and at least for our Inner Circle members, like I said, they come back to our seminars to ask us questions and get our support. Just the other day, I think well, at some point I'll show you our Facebook page, but we are excited about the fact that I know how much success I've had using myofunctional therapy in my practice, and I want to share that with you guys. Whether it's something that you're implementing into your practice at a school, whether you want to be the myofunctional expert in your practice, like we had Kim, who she had a thriving private practice, and she just wanted to be the myofunctional expert within that practice, and she's achieved that and then some. Whether you want to start your own practice. I mean, I already told you about Emily, Courtney, but there are so many people that everybody has different goals and aspirations. And what I think is fun is that myofunctional therapy can fit into any of those avenues. So what are you going to get for being in the Simon Says membership is you are going to get certified in all of our programs. You are going to get business development support, and you're going to have access to the portal. And this is what we've been working on for so many months. And I'm so excited to share it with you. I just want to give you a glimpse. This is like what it looks like when you open it up. But every single one of those blue tabs, like the Get Started Here, the Tongue Tips video exercises, they all have like 10 to 20 little clicks windows underneath them. That's all content. Again, needed to stop making content. But we've organized it for it's easy, like right at your fingertips. So like if you need a video exercise for a kid to do, you click on it. They're organized week by week. You just hit it and you can send it to your clients. If you have an evaluation coming in and you don't have those, you can open up a digital copy of your evaluation tool and just type it in and send it off. I mean, we have thought of, I'm sure there's more to think of, but we've tried to think of everything to make this as user-friendly, accessible, and available to you as possible. So there's not words for how excited we are to have taken all the content and created this portal with it. So what are you going to get for the membership? You are going to get, can you tell there's like a running theme? I just keep repeating these things. You're going to get certified in all of our programs, allowing you to come to any of our seminars. You're going to get business development support so that you can have success in your business endeavors. You're going to get access to the membership portal so you can have anything, any materials, any tools, any support at your fingertips. And part of that is you're going to get tools to create an interdisciplinary team. I haven't talked about an interdisciplinary team, but they're an intricate part. If you've heard me talk before, I believe that myofunctional therapy really should be a team effort. It's collaborative. Just the other day, I met with 2 other speech therapists and an orthodontist and a dentist and an ENT, and we all had drinks and appetizers together, less drinks, more appetizers, in an effort to talk about our cases and to talk about how we could collaborate moving forward. So again, I shared some of my collaborative tools for them to use so that we could have good communication. This is a goal to create unlimited referrals. I mean, just yesterday, one of our inner circle members, Megan, we spent some time on the phone because she had done a new evaluation. She needed to send her client to the ENT and she had no relationship with that ENT. So I told her to use the communication pad, fill it out in completion, send it in an email with her statement of what she was looking to get out of that patient's needs. So trust me, guys, I've spent, oh, here it is. This is actually an example of that communication pad. I've spent a lot of time and a lot of money, a lot more than the numbers you even see here, creating these tools and materials for you. I want to take all those rabbit holes that I went down over the course of 9 years. I want to take all that out for you. I want it all to be at your fingertips so you don't spend time making marketing materials that literally took me 2 years to make just the right one with just the right words. I want you to take my marketing tool, my pamphlet, I want you to stick your picture on it, write your bio, and take it with you to a professional so that you can get some referrals. And I want you to do it in a fingertip button press with Julie's video explanation of how to order them and make it as easy as possible. I mean, that's the goal here. So what are you going to get? Here we go again. You are going to get certified in all the Simon Says programs. You're going to get business development support. You're going to get access to the membership portal, tools to create an interdisciplinary team, and access to a community of like-minded SLPs. This part is fun, guys. You know, we all join different Facebook groups, and this one is another opportunity and way for us, knowing that everybody in this group is providing myofunctional therapy. This is just from like last week. You can see a bunch of posts. Somebody was actually asking about myofunctional kits. Somebody else was asking about a client that they needed a little advice on. Caitlin, God love her, Caitlin just came and she said, after attending the training back in January, I feel like every kiddo I see has OMDs. That's right, because it's 81% of your caseload, guys. Here are some things I'm seeing. Open mouth posture at rest, mouth breathing, speech errors, narrow high arched palate, sleep apnea, and she goes on to ask questions, and then she asks about thumb suckers and are they appropriate for tongue tips, and depending on the age of that child that she was asking about, that child was actually more appropriate for tiny tongue tips, the one that she had in specific question. So the goal is to create a community, like I said, of like-minded SLPs, a powerful, forward-thinking group of SLPs, the best in the world, on the planet, I think is what I said. That's the goal. So if all joining the Simon Says membership if all it did was certify you in OMT and allow you to implement it into your current practice or start your own practice immediately, like, would that be worth it? If it gave you tools to create an interdisciplinary team for referrals, would that be worth it? If it gave you access to the portal, giving you every bit of materials, tools, business acumen right at your fingertips in an organized, easy to access way, would that be worth it? Well, I think, you know, what I want to be clear about is I'm not charging you $9,000. I think we have paid our dues. We've spent an exorbitant amount of money in grad school. They didn't teach this to us. I anticipate that will change in the future. But I think that a fair amount is $57 a month. So I think for just $57 a month, you can get certified in all the programs that allows you to come to any seminar you want to join us for. I anticipate these seminars are going to be super crazy crowded, and that's fun for me because I'm going to bring in specialists to talk about all kinds of things aside from myself. We want to give you business development support. We want to give you access to the portal. We want to give you tools to create an interdisciplinary team, and I want to give you access to our community for like-minded SLPs, everybody excited and pumped and feeling the benefit of what their clients can get out of it. When you go onto SimonSaysSpeech.com, you'll see when you access the portal to sign up, you will go to www.SimonSaysSpeech.com. You will see that we actually have a couple different models. We have a school-based membership for if that's what you need. We have programs for schools, universities, and small practices, or individually for $57 a month. So go to www.SimonSaysSpeech.com to access the portal and sign up. And I think, do we have a free trial? Yeah, we have a free trial for a week. So feel free to go on and access that as well. You know, you're going to fall in love. You're going to realize how amazing it is. And we've worked really hard to make it beneficial and useful for everyone. So please feel free to send us your questions. Julie is here with me today, and she can field any questions. We can email you back or answer any questions that you might have. I hope you guys are as excited about these changes in 2019 as we are. We are thrilled. We are excited. And we can't wait to see what's going to come next. So have a great day. Do you have a question?
I have one question.
Okay, one question already came up.
And that is from Catherine Billings.
Okay.
And
okay.
Let me pull it up. Sorry, she's taking one extra second.
Okay. We're getting the question.
Great. Here we go. So do most insurances cover OMT, or do you bill under general oral face dysphagia code or other speech disturbances code?
Great question. And what was the first name? It was Catherine. Catherine. Okay, Catherine, great question. Yes. Insurances, I find, do cover much of this because I do code it exactly as you said, as an oral phase dysphagia, as well as other speech sound disturbances. There was a period of time where I was coding M26.59, which is malocclusion due to oral habits, tongue thrust, etc. And I've gotten conflicting responses. So sometimes they will cover under that or not. So I will have the patient call to see what their coverage would be for that diagnosis code. And I think because it's billed under swallowing, because I find that much of the issues are related to that, I feel like that's part of the reason why they get better reimbursement. So great question, very appropriate.
So I have one asking whether they can get CMHs or CEUs.
Okay. What's that? Okay, so that's a great question, Stephanie. Thanks for asking that question. In the past, for the past year, we've been offering CMHs, which are really equivalent to CEUs. We are in process of getting certified from ASHA. It's like so close. We're like a minute away. So this is happening. It's just a matter of when. But you guys can anticipate that that'll be in the future. But in the meantime, it's CMHs, which again, Julie, you can talk to that. Yes. But it's, yeah, go ahead.
So CMHs are certification maintenance hours. They are the equivalent to CEUs and also recognized by ASHA in the same.
It's just not put on your CE registry, so you have to submit it yourself, right? Yes. Or we submit it for you.
We submit it for you. The only time that you would need to submit anything of verification attendance is whether you get audited or not.
Okay.
And that's about it.
So Stephanie, hope that answers your question. If you have any others, feel free.
I do have a few people asking if it's online or live. So if you want to talk about how awesome our live events are, we don't offer an online event.
Yeah, so that's coming in the future, guys. Our goal is to really migrate towards some online education, and it's going to happen. It's just we're working this out. But right now we love our live ones because we're able to offer a little bit more of a dynamic experience. So sometimes we have people working with our business coaches. Sometimes we have people working with and talking to the orthodontist or dentist. So we make it really as dynamic as possible and as personal as possible. Like you could see in that video that Deanna was talking, that everybody had their yellow paper and they were writing out their goals. It's creating, you'll see it in the membership portal, of identifying what your vivid vision is, what your own personal goals are, personally, professionally, in life. So I think we have a lot of questions coming through.
A lot of them have been asking if it's live or online
The classes.
training. Yeah. So
But here's the good thing. This is how I kind of feel about it. We tried to price this in a way, $57 a month, so that you could come to any seminar. So in the past, you'd have to worry about travel and be paying $5,000 for your seminar. Now you're paying $57 a month and you can come to any seminar. And we try to travel around the country to get as many as we can. So again, our hope and our goal is that we've priced it in such a fashion that, being a part of the membership, I did want to let you know that we are going to be constantly making videos to be educating you. So even if you either come to a seminar or you can't come to a seminar, you can post questions and we can respond to them via videos to maybe help explain things a little bit more.
Catherine has a great question.
Okay.
She says, can you talk a little bit about the frequency of referrals for SLPs starting their own practice in smaller towns?
Like how many of our inner circle members have done
Just
that?
how, I would assume more about how referrals between orthodontists and SLPs.
Okay, so what we've done is we've created in our membership portal, again, 9 years of my rabbit holes, we created a lunch and learn webinar, kind of like what I did today for you, but it's one that you can take into professionals in your area, no matter how remote or whatever area you're in. So you would take that into an orthodontist, you would take it into a dentist, you take it into a pediatrician, you take it into an ENT, whoever your local professional is that you want to build up a relationship with for referrals. And you go in with your lunch and learn, and then one of other things we provided is a list of all the items you want to take with you into that lunch and learn, as well as the marketing materials that you carry with you, and you hand them to your brochures to that professional so they can literally take that brochure and hand it to their clients to contact you. So I hope that answers that question. We help you, and I think, we help you use the items that we have, the tools for screening. We have screening tools. I mean, seriously, the list is endless, guys. We have screening tools that you can take into an orthodontist and have them use it with their patients to see if they tick off any red flags for myofunctional disorders. And then if 2 or 3 of these red flags are kind of checked off, then they give them your referral brochure. Or better than that, I go into an orthodontist office 1 day a week and I schedule 1 hour for screenings, and I go into their orthodontic bay, and I actually do the quick 15-minute screening myself and then tell the orthodontist whether they need a referral or not. So I can help the orthodontist by offering to do that for free, knowing that I'm going to get referrals out of it. I hope that answered the question in completion.
I think we are good.
Okay, there's a ton more questions, guys. I want to tell you that, last year we sold out. I'm sure you saw because we were posting it all over social media, but we sold out of a bunch of our seminars because we just filled the seats. And I kind of anticipate, based on the 400 people that we had on today's webinar, we can only host a certain number of people at a time. So make sure that you click and you join the membership, and then you start planning when you can join us for a seminar, because I anticipate they're going to fill up pretty quickly, just because we've priced it in a way that we can give OMT for all SLPs. So I'm so glad that you were here today. I'm so grateful that you took time out of your busy day. Trust me, I know how hard it is to set aside an hour. I have like 6 webinars sitting on my computer waiting for me to watch them. So I'm so grateful. And now Julie's going to share that birdie video, since you've stayed with me till the end. But have a fabulous day. Get excited about OMT for all, and have an awesome day. Thanks for being here. Take care.